Margaret was 68 years old, and if you met her back then, you never would have guessed anything was wrong. Every morning started the same way. Coffee brewing in the kitchen, crossword puzzle spread across the table, radio humming softly in the background while she filled in answers faster than most people half her age. She remembered birthdays without reminders, phone numbers without contacts, and stories from 30 years ago with perfect detail. Her daughter once joked that Margaret was the family search engine because if anyone forgot something, she always had the answer. Then slowly, almost invisibly, things started changing. First, it was little moments. She forgot what she had eaten that morning. Then she got lost driving home from the grocery store she had visited every week for 2 decades. Conversations became loops. She would ask the same question 3 times in 10 minutes and never realize it. Her family panicked. Her doctors began discussing early Alzheimer's disease. And honestly, everyone believed that was the explanation. But they were wrong. The real problem wasn't hidden deep inside Margaret's brain. It was sitting quietly inside her medicine cabinet. After a full medication review with her physician, several prescriptions were adjusted and a few were carefully removed. 4 months later, Margaret was doing crossword puzzles again. Her memory sharpened, her personality returned. This is not some miracle recovery story you only hear once in a lifetime. It happens far more often than people realize. And today, we're going to talk about the medications that may quietly interfere with memory, focus, and mental clarity in older adults, often without anyone connecting the dots until it's too late. Before we go any further, I need to make one thing absolutely clear. This is not about fear, and it is definitely not about throwing away your medications. Many of these drugs help people every single day. Some are life-saving when used correctly. But what most people are never told is that certain medications can affect the aging brain very differently than they affect a younger one. The danger often isn't one pill by itself. It's the slow buildup over years, especially when several medications with similar side effects start overlapping. And that brings us to the first medication on this list, one of the most overlooked memory disruptors in America, diphenhydramine, better known as Benadryl. Now think about this for a second. How many people over 60 keep a bottle of nighttime sleep medicine beside the bed? Maybe it's labeled PM. Maybe it's marketed as allergy relief. Maybe it's just something taken occasionally to help with sleep. It feels harmless because it's over the counter. No prescription, no warning signs, no sense of danger. But inside the brain, diphenhydramine works by blocking acetylcholine, one of the most important chemicals involved in memory formation, attention, and mental sharpness. Younger brains can compensate for that loss more easily. Older brains often cannot. And when this happens night after night, month after month, the effects can become significant. People begin describing brain fog, slower thinking, difficulty finding words, and short-term memory lapses. What makes it especially tricky is that many people never suspect the medication because the symptoms appear gradually. They assume it's stress, aging, or exhaustion. Meanwhile, the real cause may be sitting right there in the nightstand drawer beside the bed, taken faithfully every evening without a second thought. Protolgi. And the deeper researchers looked into long-term PPI use, the more complicated the picture became. It wasn't only about vitamin deficiencies anymore. Some studies began suggesting these medications might also influence the buildup of harmful proteins associated with neurodegenerative disease itself. Now, that doesn't mean everyone taking a reflux medication is headed toward dementia. Not even close. But it does mean people deserve to know that long-term use should be monitored carefully instead of treated like an automatic lifelong habit. The reality is that many older adults stay on these medications for years simply because nobody revisits the prescription. And that pattern repeats itself again and again throughout modern medicine. Which brings us to medication number 7, bladder control drugs. This one frustrates a lot of people because overactive bladder can seriously damage quality of life. Interrupted sleep, constant urgency, fear of accidents in public, it's exhausting and embarrassing. So when someone is prescribed a medication like oxybutynin, they're relieved to finally have help. But what many patients are never told is that oxybutynin is one of the strongest anticholinergic medications commonly prescribed today. In other words, while it relaxes the bladder, it can also interfere with the exact same memory pathways the brain relies on to stay sharp. And unlike some medications that barely reach the brain, oxybutynin crosses directly into it with surprising ease. Over time, some people begin noticing subtle changes. They lose track of conversations more easily, they misplace things constantly. They walk into rooms and forget why they went there. The scary part is how normal these symptoms seem at first. Most families brush them off as senior moments. Few people ever stop to question whether the medication itself could be contributing. Meanwhile, newer alternatives now exist that work through completely different pathways and appear to carry far less cognitive risk. But many patients are never informed those options even exist. Now we need to talk about a category of medication that millions of people have an emotional relationship with because for many, these drugs once felt like survival itself. Benzodiazepines. Medications like Xanax, Ativan, Klonopin, and Valium have helped countless people through panic attacks, overwhelming anxiety, grief, trauma, and severe insomnia. For someone trapped in relentless fear or unable to sleep for days, the relief can feel life-changing. And that's exactly why these medications are so difficult to discuss honestly, because the short-term benefits are real, but the long-term effects on the aging brain can also be very real. Benzodiazepines work by amplifying GABA, the brain's natural calming system. In the beginning, that calming effect feels like peace. The mind slows down, the body relaxes, sleep finally comes. But over time, the brain adapts to the constant chemical signal. Memory processing begins slowing. Mental sharpness fades. Learning new information becomes harder. Some people describe it as living behind a thin curtain, awake but never fully clear. And the most dangerous part is the cycle that develops afterward. The longer someone takes benzodiazepines, the harder it becomes to stop. If they miss a dose, anxiety often rebounds even stronger than before. Sleep becomes worse. The medication starts feeling necessary, even if it may now be contributing to the very symptoms it was originally prescribed to treat. This is why experts strongly warn against abruptly stopping these medications without medical supervision. Withdrawal can be intense and, in some situations, dangerous. But for many older adults, gradual tapering under professional guidance has led to remarkable improvements in alertness, memory, and emotional stability. The key is recognizing the possibility that the medication itself may be playing a larger role than anyone realized. And that realization alone has changed lives for countless families who once believed cognitive decline was simply unavoidable aging. Now let's talk about a medication category that often sparks immediate debate the moment it's mentioned: statins. And before anyone misunderstands this section, it's important to say clearly that statins have saved countless lives by reducing the risk of heart attacks and strokes. For many people, they are absolutely appropriate and beneficial. But the relationship between cholesterol and the brain is far more complicated than most people realize. Your brain is made largely of fat, and cholesterol plays a major structural role in maintaining healthy nerve communication. It helps form the protective insulation around nerve fibers and supports the connections neurons use to send signals efficiently. So when cholesterol levels are pushed very low for long periods of time, some researchers believe certain individuals may begin experiencing unintended cognitive side effects. People describe episodes of forgetfulness, difficulty concentrating, slower recall, and mental fog that seem to appear only after starting or increasing a statin dose. What's especially interesting is that not all statins behave the same way. Some cross into the brain more easily than others, which may explain why certain people notice symptoms while others never experience any issues at all. This is why conversations about medication should never be one size fits all. Two patients can take the exact same drug and have completely different outcomes. One person feels healthier than ever, while another quietly struggles with memory changes nobody initially connects to the prescription bottle. And then there's another medication that surprises almost everyone because it's prescribed for such a wide variety of problems: amitriptyline. Some people receive it for migraines, others for nerve pain, insomnia, fibromyalgia, or chronic discomfort. It's been around for decades and is still commonly used because it can be very effective for certain conditions. But amitriptyline also carries an extremely powerful anticholinergic effect. In fact, its impact on memory-related brain chemistry is so strong that researchers have repeatedly associated long-term exposure with significantly increased cognitive risk in older adults. The most troubling part is how subtle the progression can feel in everyday life. Not dramatic confusion overnight, just a slow fading of mental sharpness that gradually becomes the new normal. That gradual decline is exactly what makes these medications so difficult to recognize as a problem. People expect dangerous side effects to feel dramatic. They expect alarms, sudden symptoms, something obvious. But cognitive side effects often arrive quietly: a forgotten appointment here, a missing word there, difficulty following complex conversations, trouble multitasking. Families adapt without realizing it. They start speaking slower, repeating themselves more often, taking over responsibilities the person once handled effortlessly. And before long, everyone assumes aging is simply taking its course. Which brings us to one of the most controversial categories on this entire list: antipsychotic medications. These drugs were originally designed for severe psychiatric illnesses involving psychosis, hallucinations, or profound disturbances in thinking. They are powerful medications that dramatically alter brain chemistry, particularly dopamine signaling. In certain situations, they can absolutely be necessary and beneficial. But in elderly care settings, they are sometimes prescribed for a completely different reason: behavioral control. An older adult becomes confused, restless, anxious, or difficult to manage, especially in memory care facilities or hospitals. Instead of investigating the underlying cause, medication is introduced to sedate the behavior. Families are often told the drug will help keep them calm. What they may not realize is that these medications can significantly blunt emotion, slow movement, flatten personality, and accelerate cognitive decline in vulnerable individuals. Some older adults become shadows of themselves within weeks. They sleep more, speak less, lose facial expression, and withdraw from interaction. Loved ones describe the change as if the person emotionally disappeared even while still physically present. And because the patient may already have memory problems, the worsening decline is frequently blamed on the disease itself instead of questioning whether the medication intensified it. This is why families must ask direct questions whenever an antipsychotic is prescribed to an older adult. Why is it being used? Is there a plan to reduce it later? Were non-medication approaches attempted first? Those conversations matter because once cognitive decline accelerates, reversing it becomes much harder. And sometimes the difference between decline and recovery begins with simply asking the question nobody else asked. Now we arrive at a medication that hides in plain sight because most people assume it belongs to one of the safest antidepressant categories available: Paxil, also known as paroxetine. At first glance, it seems similar to medications like Zoloft or Lexapro. Same family, same purpose, same general reputation. But chemically, Paxil behaves very differently inside the aging brain. Unlike most modern SSRIs, paroxetine carries significant anticholinergic activity, meaning it interferes with the same memory-related brain pathways we've been discussing throughout this video, and that single difference changes everything for older adults. Some patients begin noticing subtle cognitive changes within months. Short-term recall weakens. Concentration becomes harder. Verbal fluency slows down. People lose their train of thought mid-sentence more often. Again, these symptoms rarely appear dramatically enough to trigger immediate concern. They creep in slowly, making them easy to blame on stress, retirement changes, poor sleep, or simple aging. What makes this particularly frustrating is that many physicians are already aware safer alternatives exist within the exact same medication class. In many cases, another antidepressant may provide similar emotional benefits with far less impact on cognition. But unless the conversation happens, patients often remain on the same medication for years without realizing it could be contributing to their mental fog. And now we come to the most important point in this entire discussion, because the greatest danger usually isn't one medication by itself. It's the combination effect. The average adult over 65 takes multiple medications every single day: blood pressure medication, sleep aids, allergy pills, acid reflux treatment, something for anxiety, something for pain, maybe something for bladder control. Each prescription may seem reasonable in isolation. Each doctor may only focus on their own specialty, but the brain experiences all of it at once. And when several medications with anticholinergic properties overlap together, the burden on memory and cognition can become enormous. This is where people often begin crossing an invisible threshold, where mild brain fog gradually transforms into something far more serious and frightening. Imagine a woman in her 70s. Let's call her Dorothy. Every night before bed, she takes a PM sleep aid because she's struggled with insomnia for years. In the morning, she takes medication for bladder urgency so she can leave the house without anxiety. After breakfast, she swallows an acid reflux pill she's been using since retirement. And recently, she started a medication for chronic nerve pain in her feet because the discomfort was making it hard to walk. None of those medications seem alarming on their own. Every prescription made sense at the time it was given. Every doctor believed they were helping. But together, those medications may create a massive anticholinergic burden inside the brain. One drug slightly slows memory, another slightly reduces attention, another increases mental fog. Individually, the effects feel small. Combined over years, they can become devastating. And here's the heartbreaking part. Many people are never warned this interaction is even possible. No one sits them down and explains that the brain experiences medication cumulatively. Families watch their loved one gradually change and assume dementia is simply inevitable. But in some cases, what they're seeing may be medication-induced cognitive decline, a condition that can sometimes improve dramatically when the medication burden is reduced carefully and responsibly. That's why this conversation matters so much. Because unlike many neurodegenerative diseases, drug-related cognitive impairment is often at least partially reversible. People regain clarity, they become more engaged again, their humor returns, their memory sharpens. Families describe it as getting part of their loved one back. Not because of a miracle treatment, but because someone finally stepped back and looked at the entire medication picture, instead of focusing on one prescription at a time. And if there's one message I hope stays with you after this video ends, it's this. Never assume sudden or worsening cognitive decline is automatically permanent before reviewing the medications involved. Sometimes the answer is hiding in plain sight. So what should you actually do with this information starting today? First, don't panic and don't stop any medication suddenly on your own. That's incredibly important. The goal here is awareness, not fear. The real power comes from asking better questions and becoming more involved in your own care. Start by writing down absolutely everything you take. Prescription medications, over-the-counter products, supplements, nighttime sleep aids, allergy pills, all of it. Many people forget to include the medications they only use occasionally, but those matter too. Next, look for medications with anticholinergic properties. There are publicly available tools and medication burden scales that can help identify which drugs may affect memory and cognition. Then schedule a dedicated medication review with your physician or pharmacist, not a rushed conversation squeezed into the final 2 minutes of an appointment. A real review focused specifically on cognitive health and medication overlap. Ask whether any medications are still necessary. Ask whether safer alternatives exist. Ask whether lower doses could work just as effectively. Sometimes even small adjustments can make a meaningful difference. And if your concerns are dismissed immediately without discussion, seek another professional opinion. Advocating for your brain health is not being difficult. It's being responsible. Because here's the truth most people are never told. The aging brain is far more resilient than we once believed. When harmful medication burdens are reduced appropriately, many people experience improvements they thought were impossible. Mental clarity returns, energy improves, conversations become easier. The fog begins lifting. Margaret's story is not rare, and neither is Dorothy's. They represent millions of people quietly struggling with symptoms they've been told are simply part of getting older. Sometimes they are, but sometimes they're not. And understanding that difference could change the course of someone's life. Protect your brain. Stay informed. Ask questions. Because the earlier these patterns are recognized, the greater the chance of preserving the memories, personality, and independence that make you who you are.